I'm Adrian Bull, Chief Executive of East Sussex Healthcare Trust, and I'd like to welcome you to the organisation. Clinical safety is our overriding priority, and there are a number of core principles to safety which we've set in place and which I would like you all to be a part of. Three key principles about safety are that, firstly, we must make sure that we listen and learn from incidents that happen so that we don't repeat the same mistakes in the future. Second, we must make sure that we comply with operational policies so that we prevent any incidents arising. And thirdly, we must make sure that we've got structures and systems which mean we're resilient for the future so that when the trust comes under pressure, we can make sure that we continue to do the first two things successfully and well. We have a structure in place which enables us to ensure that we're complying with key operational priorities, clinical governance structure, and I would encourage all junior doctors and other members of staff to contribute to that. There are a number of specific working groups on issues ranging from priority conditions such as promoting the treatment and diagnosis of sepsis through to more general issues such as dealing with mortality or indeed end-of-life care. And there are a number of groups which work on those things, and they all feed into a single oversight committee which is co-chaired by our medical director and our director of nursing. In terms of learning from incidents and learning as we go, first of all, it is really important in my view that the organisation is seen as one which is a learning environment, not only for people in formal training but also for people who have been in their positions for many years. We continually learn. So education and the value of education is set very highly in the Trust's objectives, not for its own sake, but because it contributes to an environment in which we continually are open to new ideas, we're continually exploring new ways of doing things, and we're continually challenging each other with the latest information and the best way to approach the problems that we all face. There's a very specific thing in the culture which contributes to safety, and that is making sure that we are always able, without fear or favour, to raise issues of concern so that the issues can be addressed without fear of reprimand or recrimination to the person who has raised them, and that we treat those issues as simple objects which we need to understand, address and put right. And I want an organisation in which anybody can challenge anybody else at any time about an issue. So I want a healthcare assistant to be perfectly confident that they can raise for a consultant orthopaedic surgeon a question about what is happening if that HCA thinks that by doing so they might prevent harm or a problem coming to a patient. We've formalised that in incident reporting, and this is where everybody has a role to play. So we have a system in which any incident which occurs, and that includes any incident which, but for the grace of God, might have occurred, so any near miss, should be formally reported on our Datix system, and there are places in which the ways of doing that are set out and will be taught to everybody. Every single incident should be logged onto that system, and then they're graded according to severity. Those incidents which have caused serious or moderate harm are fully investigated through a root cause analysis. Feedback is given to all concerned, lessons are learned, and that is reviewed by a senior group chaired by our Director of Nursing. Those incidents which don't cause moderate or serious harm, but which are minor or indeed no harm at all, are also investigated. They're investigated within the clinical division, and each one of those gets a report. In all cases, there should be feedback to the person who initially raised the incident so that they are confident that the issue they've raised has been addressed. And if any person having logged an incident doesn't get feedback about it, then they should go to their manager or their clinical supervisor to make sure that happens. And that embeds an approach in which we make sure that everyone feels part of ensuring that our whole system is safe for patients, that we're providing the best possible patient care, and we all have a role to play in doing so. So in summary, what that means for each individual who comes here is that they should expect to take part in a culture which is open, transparent, and in which they feel confident to raise any issues of concern that they have, both at the time, but also if they see an incident that either happens or could have happened, then they record that on the Datix system in confidence that that will be followed through and investigated at the appropriate level. One key point in this is the duty of candour. Now, the duty of candour is an obligation that we are under as an NHS, quite rightly, that should we identify an incident which has given rise to moderate or major harm to a patient, then we are obliged to inform the patient of that and to tell them how it's being investigated, and then subsequently to tell them what the outcome of the investigation is and the actions that are taken as a part of that. So not only for our own sakes is it important that we record and log all incidents, but it is also a constitutional duty under the duty of candour for us to do so.